Good afternoon. Thank you so much for being with us today and answering these questions for our medical students. I truly appreciate your time and your busy schedule, Dr. Kristen Conrad Schnetz. So, I'd like to introduce you to our audience. Dr. Kristen Conrad Schnetz is a general surgeon at Cleveland Clinic. She is the vice chair of education for the Digestive Disease Institute for Cleveland Clinic, which spans the entire enterprise, which not only includes in the United States, but locations abroad as well. She is a program director for the general surgery program at Cleveland Clinic South Point, which is one of the few programs that has osteopathic recognition, which is fantastic. She is the chair of the Department of Surgery at Cleveland Clinic South Point and is the immediate past president of the American College of Osteopathic Surgeons. She is on the program planning committee of the Association of Program Directors in Surgery, and she sits on the Osteopathic Recognition Committee for the ACGME. She's currently practicing general surgery at Cleveland Clinic and takes so much of her time to spend with students and really foster leadership in her students. Thank you again for being with us today. We wanted to ask you some questions that really will help our students as they're applying to the general surgery residency programs across the United States. So I'm going to go ahead and ask you these questions. Feel free to be candid and answer to the best of your ability. And whatever you are able to provide us today will be so helpful for students that are currently applying. So thank you
Mhm.
again.
Yeah.
So to start, I wanted to ask you if you evaluate allopathic candidates and osteopathic candidates separately. For example, do you stratify them before interviewing them, or do you have a process to make it a little bit more streamlined for making sure both candidates get fair evaluation?
First and foremost, Dr. Segunra, please let me just say thank you for inviting me to be a part of this. I think what you're doing is really fantastic for our students. So I appreciate being included in this. To answer your question, I would say, like you mentioned earlier, our program has osteopathic recognition. There are 5 general surgery residency programs in the United States who have that. That basically means that our curricula includes extracurricula, just like you are. All of our osteopathic students get in medical school. It includes extracurricular curricula to continue to really foster our osteopathic principles and practice. So our residents do OMT skills labs. They do OMT in the clinic. They do it on inpatients. They're learning about other osteopathic principles as well outside of OMT, about the psychosocial aspects of care as well. In regard to looking at different applicants, MD versus DO, programs with osteopathic recognition have a policy for who meets the requirements for matriculating into the program. So for our program, you have to have a certain number of hours completed in training for osteopathic principles and practice if you're an MD applicant. The vast majority, as you can imagine, MD applicants don't have that. So that really eliminates a large portion of the applications that we have to review. We review every single osteopathic application that comes through our program and any MD applications that come through that meet the requirements of our policy. We do get applicants who email us to ask us about that. And as long as they can show us that they meet those requirements, we review their applications the same that we do our osteopathic candidates. There has not been one MD candidate who's applied who's met the hours needed for osteopathic principles and practice for our program. And each program with osteopathic recognition has different policies. So you just have to figure out which program, what their policy is, because some may be candidates and can opt in, and some matriculate right from the beginning. So that's also something that's important for our MD counterparts to know if they're applying to one of the 5 programs in the United States who have that.
Thank you so much for that. Just to help direct our students, for them to really learn about those 5 programs that have osteopathic recognition, where can they go to get more information on that and learn more about that process?
Yeah, you can go to the ACGME website. They have, you can search for programs who have osteopathic recognition on the ACGME website. And AACOM actually has a search function on it as well on their website to look for programs who have osteopathic recognition. You can, on the ACGME website, you can look for specialty specific. I don't know if AACOM has that. I would imagine they probably do. But I think in either site, you should be able to find the programs that have that.
Fantastic. Thank you so much. Now, when you're looking at the applications, are there certain aspects you wish to see in an ARS application of your candidates?
Yeah, I think our program, the way that we do it, and I know a lot of programs do it obviously differently, but our program, we try to have a holistic approach to our application review. We um, divide up amongst our program all of the applications and award points. We go based off of points depending on what it is we're looking for in an applicant. And that can range from community service to leadership skills, signs that you have grit or resilience, depending on like what your involvement has been with different things, whether it's sports or music or art or whatever it might be. We're looking for candidates who have experiences outside of just being in the walls of the hospital and getting good grades. So there are certainly things that we look for in the application that are outside of publications and scores. And like I said, we do a point system, and that's basically how we figure out who we're going to offer an interview to and who we don't. So that takes some time to go through all of the applications, but we want to make sure that everybody's got a fair shot.
That's so good to hear that there are multiple aspects that you look at in that application process so students understand that it's not just about one number or one thing, that it's really looking at the whole candidate. So thank you for that.
Mhm.
Now, how do you utilize step one or step two or level one, level two with Comlex when you are looking at the different metrics of your candidates?
Yeah, so I know that the majority of programs require USMLE, and I want to answer this question. Sorry about the pup. We'll take whatever you get the highest score on. So if you get the highest score on USMLE, we'll take that. If your highest score is on the Comlex, we'll take that. So you're not punished for not taking USMLE, but in general, I would advise that students continue to take the USMLE as of right now. And that leads me into the second part of my answer. Um, we are working with the American Board of Surgery and NBOME to look at the correlation between Comlex and first time pass rate on the ABS qualifying exam, and hope to have that information out to everybody soon. I big shout out to Dr. Jean Sandella and Dr. Jack Boulay at MBOME, who are just as passionate about trying to get us in a place in medical education where the students only have to take one licensing exam and not two. So um, we we do look at first time failure rates. If you failed on the first try, we don't we do not look at those applications. So look, you have to pass on the first try. And the fact that it's gone from being scored to pass fail, I think gives us space to be able to not have to worry about that level one scoring. In our program, our personal requirement is that you pass. If you take both exams, you pass both exams on the first attempt. And since the scoring has gone away for the level one and step one, that's one less thing that candidates have to worry about. I personally did not score very high on my level one. So the pass fail would have benefited me, but that would be one of our requirements. And I would imagine um, that it's probably a requirement for most surgical programs that you need to pass on the first try.
Thank you so much for that. And yes, that seems to be a common process or a common aspect of the application process because it's really important for candidates to understand that the metrics in which we use, which are multiple, scores are part of it. But by
Mhm.
looking at the ability of students to pass standardized exams is really important because of their correlation to their passing their board exam after
Mhm.
residency. So there definitely is a correlation, and that is something that we do want to make sure the students are aware of. That that's the reason why these scores can sometimes be heavily weighted. It's a prediction of the future ability to pass your board examination, which is a culmination of all the work you've done for several
Mhm.
years. So it's important for that to be evaluated early on in the process, which it is. So thank you so much for that. Now, when you're looking to evaluate their applications, one of the things that some programs look at is research. Can you tell me a little bit about if you consider research in the application process, how much it weighs, and what aspects of that are important to you for your program?
Yeah, we do look at research. I would say it's probably one of the more heavily weighted things in the application, and it's not just the amount, it's the type of research. So, we also separate out our point system based not just on research but also on presentation. So if you have a local presentation or a regional presentation or a national presentation, you'll get different points based on the levels of that. And then you also can get points based on the different types of publications you get. So if you have a case report, you'll get a certain level of points. If you have a retrospective study, you'll get points for that. If you're reporting on a QI project, you'll get points for that. So publications are certainly important. I think if you had a program director who said that they're not important, they're lying to you. So, but they are important on our program. Our program is a bit different in that we're not trying to get all of the residents to do specifically, prospective trials and get publications that way. We're trying to really foster things that they're passionate about, whether it's community service, creating programs to create pipelines for local high school students, or I have a resident who is working on developing an OMM surgical curricula for students to spend a year with us to gain surgery experience and as well as OMM experience in surgical patient population. So we have people working on different types of things, but it is certainly something that is important to us. Definitely understand that it's not something, or it is something that we can teach, even if you don't have a ton of it. But it does make up a pretty decent portion of what we're looking at in the application process.
Such an important point that you hit on because you listed some different types of research that students can be involved in. A lot of times, students think that research just means basic science, right? Lab work, which a lot of students in the undergraduate level tend to be a part of, but some aren't. So, to understand that your research can include things like quality improvement. It can
Mhm.
include clinical case reports. It can include retrospective studies. And of course, it can include basic science studies as well. So just to know that research is not it's not a unidirectional thing. There are multiple things that you can participate in. And for students who are maybe in their first and second year of medical school and they are thinking that they want to do surgery, what kind of advice do you have for them to get involved in research at the first and second year level? Are there some tips and tricks that you can give them?
Yeah, I would say the biggest hurdle I think are for our students is finding a mentor. So if you can find one, that's great. And even if you find somebody who's doing research who can't be a mentor to you, maybe ask them if there's somebody they can put you in touch with. So finding a mentor is probably first and foremost. And working on that outside of studying and trying to get good grades and taking your board exams and all that can be a bit time consuming. Another thing that you can do is just be observant. So if you see that there's an issue or a process issue or something happening that you want to improve, you could make a project out of that. So you could lead that, and then having an idea in mind can help you get mentorship as well. So I think it does. You don't have to have a mentor up front to get an idea. You can be the source of the idea by being observant in your preclinical years. Just that's what you're there when you're going there. You're going there to observe, ask a lot of questions, be curious, The second thing would be is if you're say you're interested in plastic surgery. If you're interested in plastic surgery, I would look at the plastic surgery literature, see what's being published, um, understand kind of what things things uh, may be well reported on and what things aren't. I'll give you an example on the general surgery side, especially in surgical education. Uh, there's not a lot of curricula, or there's not a lot of curricula that's reported on around like us teaching malpractice or us teaching um, medical errors and how to navigate that when that happens. And in surgery, you do something procedural, it's going to be that way. You're going to experience a complication somewhere along the line. So just knowing how to navigate that emotionally and having curricula around that is missing. It's lacking in the literature. So finding gaps in the literature you can report on. So just be curious. An idea can lead to mentorship, and then the other thing is if you can find a mentor can lead you to an idea. So there are, I think, two ways that you can really start to push yourself. But research is going to be the big thing, and getting good scores, because even though I and a number of other programs do a holistic approach, like those are going to be two of the main things that most programs are looking at. So to set yourself up for success, it's going to be research and good scores.
Fantastic. That's so important for students to hear. And that trick about really finding a mentor, right? So in those early clinical years, when sometimes you might do some rotations to get early clinical experience, you might see a really cool case. You might kind of get a really good patient interaction, and they have a really unique story or unique disease process. All those things can go from interesting to research projects. So
Mhm.
thank you so much for that. Now, in terms of sub-Is, or some call them away rotations or audition rotations, what do you recommend? Should candidates do sub-Is at the institution that they're looking to go to?
Yeah, I think so. There's a number of studies that report out on this, and doing a sub-I is probably one of the most important things that you can do as somebody who's interested in a program. I can tell you that a sub-I is what made me be able to become a general surgeon. Just being who I am, I think, and performing and being able to interact with the people on rotation really helped my cause for being able to match somewhere. And that still holds true even after single accreditation. There's a number of studies, even at tertiary academic centers, that show that a fourth year rotation at the program that you're applying to increases your odds of an interview and matching at a program. So, absolutely, it is an essential part of your application process. Now, as far as duration of rotations, because I know in the osteopathic world, each of the schools, and I'm sure it's similar on the allopathic side, the schools probably have different uh, opportunities for elective rotations where you can either do 2 or 4 week rotations. Um, and so I would say try to rotate as many programs as you can with the time that you're given. If they require you to do only 2 week rotations, do what you can within the confined limitations of whatever your school allows you to do, just to maximize your opportunity. The other thing you have to take into consideration is cost when you're traveling around and going to all of these different audition rotations or sub-Is. It can be very expensive. So trying to see if there's housing available at the different places that you're going to, and trying to even see if there are residents who maybe are willing to have people stay, things like that. There are different opportunities for trying to save money, because I know that the students are strapped for cash as well. So something else to keep in mind.
It's so important to hear that and for students to know that doing these sub-Is are important, and also to remember during that period of time when they're there, it's not just a matter of the program interviewing them, they're also interviewing the program, because then they get to meet the residents and meet the faculty, meet the
Mhm.
staff, because as I've said before, that relationship that you're going to have with your team that you're going to be working with every day during surgery residency, it's like your family because you spend
Yeah.
more time with them than you probably will with your family for those several years. So it's important to know that by getting out to these programs. And even if you can't do it in a sub-I fashion, but at least if there are in-person interviews and you're going to these programs, definitely you want to have some sort of FaceTime so you can see for yourself what kind of interactions that you'll have, because that would be your home for the next 5 to 7 or more years. So that's really important. So thank you so much for that.
Mhm.
Now, following up on that, in terms of networking, that's one of the big things that's so important for students and prospective residents now to do is to network with programs and network with program directors and faculty. How do you suggest that they do that in the best way? What are some tips and tricks you can give them for the best way to network and get themselves out there, have FaceTime with these decision makers before the time comes for them to actually apply?
Mhm. Yeah, I would, knowing what I know now about schedules and just how busy everybody is, I'm trying to think of what I would do if I were a fourth year student. And I think probably the most important thing would be once you're there or even beforehand. So, say you're a first or second year student and there's a program that's nearby. I would try to get in touch. And even if it's a short, quick meeting, 15-20 minutes, just to meet up and, express your interest. I think that's really important. If I can only speak for myself. I can't speak, and maybe there are other people who are program directors who are much better at this than I am. But if a student comes up to me and is like, "I'd like to meet with you to talk about it," I'm always happy to meet, have a phone call, whatever it may take to try to help guide them through the process and give them advice. But if I'm personally not good at actively scheduling that, so, like, they would need to either go through the coordinator or, I find doing phone calls is the best because I can do that in the car, and it's a half-hour drive home, and it's a half-hour drive into work. So if they can have time during that, I'll make time for that. The other thing that I would say is, um, attending meetings where there are a lot of program directors, like the Association of Program Directors in Surgery. I think in the osteopathic community, the students find a lot of value in the med student section, especially at our fall conference, because they get an opportunity through the speed mentoring program to get in front of a lot of different osteopathic surgeons. That's also an opportunity. Our community, our family is small, so people know people. So being able to pick up the phone and say, "Hey, I have this student. They're really great. You should be interviewing them," is also helpful to know people, not just networking specifically with the program directors, but I think networking in general and getting to know people is really important. And a big part of that would be at some of these meetings, but then also just trying to maximize your opportunity while you're on service as well.
Excellent. Thank you so much for that. And like you said, with trying to get things scheduled, a lot of things have to be student driven. Why?
Mhm.
Because we are all very busy and have hectic schedules. So I always implore students to be very professional during the process and
Mhm.
don't give up, right? Sometimes you have to send 2 or 3 emails because we may have seen the first one or the second one and meant to respond to you, but we got called to go into the OR for something and we didn't make it to it. So
Right.
definitely be persistent, but be professional during the process and understand that we are working and very busy. And so sometimes it does take a little while to get things scheduled and done, but just be persistent. And also on the student end, to make sure that they follow through, right? That's one of the
Mhm.
biggest things for us is that we are giving our time, right? This is
Right.
our time that we're giving. That's not necessarily sitting there for students. We're making time out of no time. And so during that process, be professional and be timely and just know that it's a mutual respect for each other. So you definitely have to
Mhm.
respect the person that you're reaching out to. So
Yeah.
thank you so much for that.
Mhm.
And in terms of the preclinical years, you gave a couple really great pieces of advice. But are there other things that you would suggest that the students in their preclinical years, so those first and second year students, any other advice that they can really hone in on and start working on now to set themselves up for success in surgical residency applications?
Yeah, I think, another things that programs are looking for are, evidence that you have grit or resilience. So being able to, be involved in some sort of organized activity where you have to learn you've had to learn what failure is like and have to bounce back. And I don't know that you'd be able to necessarily do that, in your first 1 to 2 preclinical years. But just looking at yourself and reflecting on where you can showcase that is going to be important. The second thing I would say is leadership skills. So you don't have to be the, you know, national liaison to the medical student section for ACOS or the Association of Women Surgeons social media chair. You leadership comes in a number of different forms, and I had one student who I mentored, and she started a community garden at the local hospital. And with that, she had to navigate like the local neighbors who didn't like her digging up all this grass, but that was like she had to learn to deal with failure, conflict. She organized a number of people, both in and out of the hospital, to come maintain the garden, was able to help set up a food pantry. Like, you don't, and this was something that she just is passionate about. She just likes growing things. So, but she turned that into a big project that she was in charge of. And so that is leadership, identifying something that's missing or a problem that somebody is having and coming up with solutions and being able to lead out in a space like that. Says a lot, I think. So you don't, like I said, you don't have to have a named position. You can lead out in different areas. And I would almost, I mean, sometimes, not even sometimes, a lot of times, when you are interviewing somebody and they can speak to something like that, as opposed to saying, okay, you were the chair of this organization, tell me what changes you made to make it better. And it was like they're just reiterating the things that had already existed. Um, the latter is or excuse me, the former is much more impressive than the latter. So it comes in different forms. So I would say leadership, outside of the things we've already talked about, studying, research, um, leadership, and um, grit/resilience, I think, is probably the big things.
Wonderful. Thank you so much for that. I think it's going to be so helpful for students as they're kind of really creating their application from an early process, because the application is not just what you do in the few months before, it's a culmination of everything. So it's so good to hear things that they can do to start working towards that. Now, in terms of letters of recommendations, who do you prefer that they are from? Should they be from surgeons that they've worked with? Can it be from primary care, gynecology, other specialties? And would you prefer to see a strong personal letter from someone in another field, or do you give more weight to it if it's from someone in a surgical field?
I think students who are applying to surgery need to have letters from surgeons. Ideally, it would be somebody who you've worked closely with, so that they can write you a strong letter of recommendation. I am I have read some of the best letters of recommendation from non-surgeons, for 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 the students, and I can tell you that I actually very highly value those. And the reason is because I want the student who, when they go out on rotation, even though they want to do surgery, like the pediatricians want them to be a pediatrician. The family medicine docs want them to be family medicine and don't understand why they're doing surgery. Like everywhere they go, they're giving it their all and learning as much as they can. And they are like the staff are like disappointed almost that they don't want to be in that specialty because they're wanted no matter what space they're in. So I think that that's very valuable. I think for me personally, I care less about the title of the person who it's coming from and more about what that person has to say in the relationship. Um, I think if you're applying to a tertiary academic center, they're going to want to see something from a department chair or a program director. I also very much highly value letters from other program directors who say, we're actively recruiting this person to come to our program. Um, I think that says a lot about who that person is. And it doesn't have to be a program director, it could be an APD, it could be a core faculty member. just to say, like, we would love for them to come to our program. You should definitely be interviewing them, because they deserve a spot somewhere. Is that says a lot more than I've also read letters, that are the same exact letters from somebody, and somebody actually, that person who wrote the letter actually forgot or didn't catch they needed to change the name, and sent they submitted since the students don't get to see it, they actually submitted somebody else's letter under them, and it was the same exact letter. So I think getting somebody who's truly writing a personal letter is much more important than the title of the person that it's coming from.
That is extremely helpful to hear. Thank you so much. Because a lot of times students will reach out to people that they didn't necessarily work with. Maybe they met once and they want a letter from that person because they think it's going to stand out more. Maybe there's that name recognition. But it's important for students to know that we do read those letters, and those letters have to actually give us information about the student. It's not great when we have those cookie cutter letters, or those letters that were not actually theirs and they were someone else's. So it is important when you're selecting your writers of your letters to make sure that they're people who actually know you. And
Mhm,
during that process too, because you work with that individual, they may not know all the details about you, but you want to make sure you submit things like your CV, submit maybe a personal statement, make sure that they have a well-rounded view of who you are, so that way when they're writing that letter, it can be as personal as they can be. It is important to know that you can get letters from people that aren't surgeons, because we will read
mhm,
them, and those are important because you may have spent multiple months on a certain rotation with a particular physician, and they will know you on a very deep level. So that is helpful. But like you said, it is good to know and important for the application process that we do also need to hear from surgeons who have worked with you as well.
mhm,
So keep in mind that the selection of your letter writers is quite important, and don't
mhm.
take it for granted. Now, if you had to give me 3 character traits that would characterize the ideal applicant, what would they be?
Um, I would say authentic, like authenticity, optimistic, and then somebody who has a very strong sense of integrity. Those would
Fantastic.
be my top 3. And how I get that from an application is it's very hard, but a lot of those things I think come from the audition, rotation, or sub-I, as well as, the interview process and probably the personal statement. That I know you didn't ask me about personal statement, but the one thing that I'd like to make a plug in for, and I didn't really appreciate this until, probably in the last few years. Your personal statement is an opportunity to tell the program who you are, and it should not be a regurgitation of your CV. I think it's important to briefly maybe mention why you're choosing surgery and what your interests are, but I think it's very, uh, it would be very helpful to know what your individual values are. Like, tell me what your most important top 3 values are and give me an example of how you have fulfilled those values while you've been on surgical rotation or when you were interacting with a surgical patient or something like that. So I think it's important for people to be able to showcase who they are. A lot of people decided surgery because they either personally or had a family member or close family friend who had surgery. So going through that experience helped them to decide, and or it was much like me. They were on rotation and they were like, that just clicked. They were like, "This is what I was like. God sent me here to do this." So I think it's not always those two, but most commonly those would be the two biggest reasons. So I think it's fine to mention um, the reason that you chose it, but really I think understanding who you are you can gather characteristics from an application. Like if you're a ballerina, I know that a professional ballerina, I know that you put in a ton of hours. You know what dedication is like. You know what hard work is. You know what motivation is. You know what working through pain is like. Like, you know, all of these different things, but I don't know who you like. I don't know what you value, and that's not on a CV. So really think about that, and then try to convey that in your personal statement.
That's such great advice. Thank you so much for that. And that does conclude the listed questions I had, and obviously the additional question about the personal statement. So thank you so much for adding that in because that's so valuable for students to hear. And what I wanted to do in wrapping up this interview was actually just bring up a study that you and Dr. Burns had published a couple years ago, where you
Mhm.
actually looked at the number of surgical programs currently training osteopathic residents, and you looked to actually solicit advice for current osteopathic medical students and how to really be competitive in their surgical residency application. And I have read that paper, which was fantastic. And I know a lot of the things that you've shared with us today are related to that paper and questionnaire. Are there any other big pieces of advice from that study that you did that you can share with our students, in addition to them going out and actually reading it as well?
Oh gosh, I don't know that I have. I feel like we've talked about a lot today. A lot of what that paper covered. We looked at USMLE, we looked at fourth year rotations. There were a number of things that we looked at in that paper that we talked about today. But that paper was, uh, I think, very helpful. I hope one day we get to a place where people and programs accept Comlex, and because it's a good test, even though people don't think it is. It's a good test, and I'm hoping that we'll be able to show that soon. So it is a good test, and people should accept it. DO bias, I think. I know we didn't really touch on that very much. I think if you ask people who haven't experienced it and people who don't think they have it, or people who don't have it, they'll tell you that it doesn't exist, obviously. But if you ask people like myself who personally experienced it, it does. It's much better than what it was. The hospital that I practice in was started because there were four docs, DO docs in the city who couldn't admit their patients anywhere because they were DOs, and so they set up shop really literally right next door to the MD hospital. So it has certainly come a long, long way. But I guess my biggest thing for encouragement is, you know, the students have a lot on their plate right now. They can only see 10 feet in front of their faces to try to to do what they need to do right now to get themselves to a place where they're competitive. But once you're out of residency and in practice, which will not be that far from now. It goes by so fast. The days are long, but the years are so short. And so once you're out, talk to people outside of the walls of the osteopathic house, because that's how you implement change. So it does still exist. There are still programs who don't look at DO students. Um, we saw that in our survey. We wouldn't report. We can't really report that. But there are programs who don't look at DO candidates at all. So the bias still does exist, but there are a lot of programs who do. So there's a lot of space for success, and I'm wishing everybody who decides to any field that they decide to pursue, but especially in surgery, that they are successful in their endeavors. So
I think it's so important. And, unfortunately, even sometimes in practice, it exists as well.
mhm,
But I think the biggest thing for students to really take from that is that be proud of being a
yes,
DO, right? Being an osteopathic physician is a privilege and is something that we should be very proud of. And not only that, I think it's how you show up. And this is what I tell people all the time, that show up and do your best at all times. And that's all
mhm,
that people are going to see. Your patients aren't necessarily questioning, what is a DO versus an MD, because you're going to give them equivalent excellent care. So I think
Mhm.
that's important for students to understand that. Be the best that you can be and know your craft. And that's really just across all specialties and really anything that you want to do in life, but definitely in medicine, is you have to be very good at your craft. The reason why it's so hard to get into medical school, so hard to get into residency, because doing this job is a hard job. We have to be good at this so we can be good for our patients. I
Mhm.
think that students have to remember that, especially when it comes to surgery, that it is a privilege for you to get to operate on patients. When a
Mhm.
patient comes to see you, they are literally putting your trust in you. They are going to choose to be unconscious. They cannot fight for themselves. They cannot fend for themselves. They cannot do anything. And they are trusting you as their surgeon to be responsible for their life while they cannot do it themselves. So
Mhm.
that's a very heavy thing, but it's also a very pragmatic thing to think about. It's a privilege. So when patients come to see me and they say, "Thank you so much for doing this and for doing that or saving my life," things patients can be very grateful. I always respond, "Thank you for giving me the privilege to take care of you because you could have chosen someone else and they chose
Mhm.
you." So remember that. And that's why this process of applying to residency is important and the selection is important because we want to choose people who we are proud to say that we train them because now patients are going to trust them, right, in their most vulnerable state. They are
Mhm.
literally conscious and cannot fend for themselves and you are fending for them. So that's something to not take lightly and remember the reason why it's hard to do this is because it's a privilege to do it.
Yeah.
So thank you so much, Dr. Kristen Conrad Schnetz, for your time today. Your words of wisdom, your time, your advice for students is quite invaluable. Your time as a program director in general surgery, doing this for years on end, in addition to your time that you've given the college, the American College of Osteopathic Surgeons, is so important for students to understand and also ascribe to or choose to want to give their time back in the future as well. By you paying it forward allows other students to see you and see you doing this to also be able to pay it forward for students when they are in that position and are able to do that. So again, thank you so much for your time today. I truly, truly appreciate you not only as a colleague, but a friend.
Mhm.
And you are someone that is truly fantastic, and I just don't have enough words that I can say, that will fit in this one video, so thank you so much, and I truly, truly appreciate your time today, and so will the students and other, members of the American College of Osteopathic Surgeons and, students across, the United States and the world looking to apply to general surgery residency, so thank you.
No, thank you, Dr. Segunro, for having me again. I feel privileged that you included me in this. So thank you so much. I feel the same way about you. So thank you.
Thank you.